Most kitchens have cloves somewhere, usually buried in the back of a spice drawer, pulled out for biryani or chai, and then forgotten. They don't get much attention, which is interesting, because the research on them is more substantial than most people expect. As a physician, one thing I've learned is that some of the most studied natural compounds are ones patients are already using at home without realizing why they work. Cloves are a good example of that. So today, we're going to look at what actually happens physiologically when you eat 2 cloves a day for 7 days, what the evidence supports, what it doesn't, and what's worth knowing. First, why are cloves even interesting? Everything starts with one compound, eugenol. Eugenol is the primary active molecule in cloves, making up roughly 70 to 90% of clove essential oil. Researchers have published hundreds of studies on it, not because someone funded a clove lobby, but because the compound keeps showing up with measurable effects across multiple biological systems. Eugenol has demonstrated antibacterial activity against strains like Staphylococcus and E. coli, antifungal properties, anti-inflammatory action by inhibiting certain prostaglandin pathways, similar in mechanism, though far milder, to common NSAIDs, analgesic or pain-numbing effects, which is why eugenol has been used in dentistry for over a century. Cloves are also one of the highest antioxidant foods ever measured on the ORAC scale, outranking blueberries, dark chocolate, and most herbs and spices by a significant margin. Now, does this mean cloves are magic? No. Compound activity in a lab dish is not the same as eating 2 cloves and curing a disease. But it does mean there's a real biological basis for the effects we're about to discuss, not folklore. Days 1 to 2. Your digestive system responds first. The first change most people notice is digestive. Cloves stimulate the secretion of digestive enzymes and have traditionally been used across Ayurvedic, Chinese, and Middle Eastern medicine for exactly this reason. If you deal with bloating, post-meal heaviness, or mild acid reflux after rich foods, you may notice genuine relief within the first 2 days. The mechanism here is real. Eugenol has shown the ability to relax smooth muscle in the GI tract and reduce gastric spasm, which translates practically to less cramping and gas. This isn't dramatic, but it's noticeable. Days 3 to 4. Something changes in your mouth. By midweek, many people notice their breath feels cleaner, not because they change their brushing routine, but because of what cloves are doing microbiologically. Eugenol has been shown to inhibit oral bacteria, including Streptococcus mutans, one of the primary contributors to tooth decay and bad breath. This is precisely why clove oil has been a staple in dental practice since the 1800s. It's not alternative medicine, it's part of mainstream dentistry. People dealing with mild gum inflammation or mouth soreness often report temporary relief during this window. The analgesic effect of eugenol is real and measurable, even in small dietary amounts. Important caveat: this is not a substitute for brushing, flossing, or seeing a dentist. Cloves can support oral health. They cannot replace mechanical cleaning or professional care. Days 5 to 6. Circulation and immune support. Around day 5, some people notice warmth, literally. Hands and feet that normally run cold may feel less so. Cloves, like ginger and cinnamon, belong to a class of warming spices that have been shown to have mild vasodilatory effects, meaning they may support blood vessel relaxation and improve peripheral circulation. The anti-inflammatory action of eugenol may also play a role here over time, as chronic low-grade vascular inflammation is one of the key factors underlying poor circulation. Day 6 is when people start appreciating cloves for respiratory symptoms. Warm clove tea, especially combined with ginger or honey, has been used across traditional medicine for congestion, sore throats, and early cold symptoms for generations. The antimicrobial properties of eugenol, combined with the soothing effect of warm steam and liquid, create a genuinely useful combination during cold and flu season. There's no randomized controlled trial proving clove tea cures the common cold, but the biological plausibility is solid, and the risk is essentially zero. In clinical terms, that's a favorable profile. Day 7. The subtler shifts. By the end of the week, what most people describe isn't one dramatic change. It's a collection of small ones. Steadier energy, fewer sugar cravings, a general sense of digestive calm. Some notice their skin looks slightly clearer, though I'd be cautious attributing that directly to cloves. It may reflect improved digestion, better hydration habits built around the ritual, or simply the antioxidant load reducing systemic inflammation. That antioxidant capacity is worth taking seriously. Oxidative stress is implicated in aging, chronic disease progression, and immune dysfunction. Regularly consuming high antioxidant foods isn't a treatment, but it is genuinely protective over time. How to actually use them? The simplest method: chew 1 to 2 whole cloves after meals. Freshens breath, supports digestion, and delivers the active compounds directly. Clove tea. Put 2 to 3 cloves in hot water for 5 minutes. Drink warm after eating is the most common digestive remedy. Overnight clove water. Soak 2 cloves in water overnight. Drink it first thing in the morning. Is frequently used for blood sugar support. Some early human trials show cloves may improve insulin sensitivity, but this evidence is still preliminary. Never adjust diabetes medication based on this. Clove and honey for throat soothing before bed works well. The combination of eugenol's antibacterial action and honey's known antimicrobial and coating properties makes this one of the more scientifically coherent traditional remedies. Diluted clove oil, 1 to 2 drops in a carrier oil like coconut oil, applied to a sore tooth is a legitimate, evidence-based short-term remedy. It buys time. It does not fix the underlying problem. See a dentist. What you need to know. Before starting, 1 to 2 cloves per day is the appropriate amount. More is not better. Cloves are potent, and excessive consumption can irritate the gastric lining and mucous membranes. Clove oil in concentrated form is not the same as eating whole cloves. Large quantities of clove oil can be hepatotoxic, toxic to the liver, particularly in children. Keep it diluted, topical, and occasional. If you take blood thinners, warfarin, aspirin therapy, or similar, speak to your doctor first. Eugenol has demonstrated anticoagulant properties, and the interaction is real. Pregnant and breastfeeding women should consult their healthcare provider before using cloves beyond normal culinary amounts. And I want to be direct about something. Cloves do not treat diabetes, cancer, arthritis, or chronic infection. Anyone telling you otherwise is selling something. Natural compounds can support physiological function. They do not replace medicine, clinical care, or diagnosis. The honest summary: cloves are genuinely well studied. The active compound has documented antibacterial, anti-inflammatory, antifungal, and analgesic properties. Eating 1 to 2 daily may support digestion, oral health, circulation, antioxidant defense, and respiratory comfort. Not because of hype, but because of mechanism. The key word is support. Not cure, not transform. Real health is mostly built on small, consistent habits that work with your biology rather than against it. And sometimes, the most effective ones have been sitting in your spice cabinet the whole time.